very excited to have Dr. Larry back with me to talk about men's health. Now, a lot of people only think about sex when we talk about men's health, but today Larry and I want to talk about men's health with men as human beings. Larry, welcome back to the show. As for the audience at home, Larry and I did our doctorates together, and he's been a TA for more than 12 years up in Massachusetts, and we love to get together and have all kinds of wild and crazy clinical conversations. Welcome, Larry.
Hello, Dr. Glad to be back.
Always a pleasure to have you. So I know there's lots of jokes about men's health, right? Like when I took statistics, one of my classmates, he says, you know why men die before women? And we all looked at him and we listed off a bunch of weird statistics. And he says, because they want to. But I think men's health it's often under-addressed, and especially under-addressed when we talk about things outside of urology. I know, for example, men have higher suicide rates than women, and all sorts of other, again, weird statistical data that we get. So let's talk a little bit about, like, what are the key things about men's health that we should know?
Well, number one, many years ago, we devoted little research to women's health, especially in heart disease. So now we've developed research and medical protocols to reduce the risk of coronary artery disease in women, because we've learned that men have large vessel heart disease or medium vessel heart disease, whereas women have micro vessel heart disease more often. So it's the smaller vessels of the heart. Women also have more peripheral vascular disease than do men. This is again because the smaller blood vessels are more affected by comorbidities in women. So we did no research until just a few years ago, specifically for women in this area. Now there is a big push in men's health, and men's health is becoming a very broad area. Not only do we have the psychological aspects of it, but we're learning more and more about sort of the psychosocial and the physiologic changes that happen with aging. Well, there was always a joke among medical providers when a male patient came in talking about their loss of libido or inability to get an erection. And doctors were always trained to hold up their hand like this. Here we go. And they say, okay, so this is an erection when you're 18. This is when you're 20. This is when you're 30. This is when you're 40. This is when you're 50. So that's how men's health was described. So now we've gone beyond that, and we're learning more about how your general health in terms of obesity, hormone imbalance, depression, lack of sleep is a major contributor to men's health and declining health. So what area would you like to touch on first, Dr. Rebecca?
Tell me about dark chocolate as an antidepressant. I know you had mentioned this, and I've heard things like that because I also remember hearing a lot about the lack of research in women's health, and with the surgical instruments were too big for women's bodies and stuff like that. I remember reading some of that even prior to our doctorate, but I don't know. Let's talk about the psychological, like you mentioned to me a while back about dark chocolate as an antidepressant. What's up with that?
Yeah, so this was, I believe back in the 80s. I believe it was the University of Oregon in Eugene. They had a very strong nutrition program, but they did a study on the effects of chocolate and PMS. Well, they found that dark chocolate, 72% and above, alleviated many PMS symptoms and reduced depression. Well, someone got the bright idea to see if dark chocolate or chocolate in general would have a similar effect on men. Now, one of the things that came out of this study is they found that, men have hormone swings monthly, just like women do. But we don't have a menstrual period to actually say, here I am. We just go through these mood changes, and they do last for about 4 to 5 days. So the research found that the 72% and above chocolate helped reduce depression and increase libido. It also helped men lose weight, which was a major factor in reducing depression and helping in overall health.
You know, that's very interesting because I know the joke is always that women are the ones who get crazy and emotional. But, you know, I tell you, the joke in my house growing up was, you know, thank God my brother was not born a woman, because had he been born a woman, like, you know, it would have been really, really bad, because my mother used to call them testosterone days. You could kind of like almost count that they were coming, and it was like everybody had to clear out, you know, it was really
Well, yeah, it's true. Men, we are now finding many things about how the almost like the homeostasis of our endocrine system works to help keep us emotionally balanced, physically balanced. There are many things we're just now touching on. So there's a lot of new research coming out that I think is very promising. I'm working in some men's health issues right now at a new clinic we're opening, and I have some interesting facts to talk about today. Number one is obesity. So obesity, people just see a fat guy. Well, it's more than just a fat guy. This is a man who he could have a totally normal testosterone level, and this is a free testosterone level, which is the one you want to measure, but he could have a high testosterone binding hormone. That comes out of his body fat. The body fat will actually convert that free testosterone. It's called aromatase, the enzyme that does it. It converts it into estrogen. So you've got this high testosterone level, and then all of a sudden your body fat converts it into estrogen. And guys wonder why they're getting, pardon my French, man boobs, and they're feeling sort of sluggish and not like themselves. Well, that's part of the reason why. Losing body fat is critical in reducing the amount of estrogen and returning your free testosterone to its normal functioning levels.
You know, that's very interesting, because when we sat down to plan this episode, I was saying you would need to have the issues, because I don't know enough to really have an intelligent conversation on men's health, but I think it's important. What about encouraging men to seek out healthcare, or is that less of an issue than people make it out to be?
Oh, it is a major issue. For example, in our clinic, we have a main door for the men's health clinic, but men also want to look good. I mean, let's face it, this started in the 80s and it's getting more and more and more prevalent. Men have to be pretty. So, therefore, we have access to a spa by using a side door out of the clinic so no one sees them going into the spa. So, this way they can come in, they can have their treatments for erectile dysfunction, or the counseling for weight loss, or monitoring of their hormone levels, and their psych evaluations and treatments for depression. And then they go into the spa and get facials and manicures and pedicures and whatever they want. Botox. We're really big on Botox right now in men's health.
Really?
Yes.
Very interesting. What are the other issues that you see in men's health? So I know we spoke about obesity, and I know we're going to talk about COVID in a little while, but what other men's health issues do you see as pressing issues in the clinic?
Well, the most pressing is obesity. We in medicine, we commonly look at obesity as being, a thyroid defect or inactivity or a little of this or something, you're just eating the wrong kind of food. Actually, obesity is a complex issue. Obesity comes about from several things. It doesn't always happen with your total calories in. You could have 2,200 calories per day and gain weight, but it's the type of calories that you're putting into your mouth. So when you think about having 2,200 calories of good lean meat, vegetables, some grains, you do want to have carbohydrates. Carbohydrates aren't bad for you. They're not the evil demon that people are portraying them to be. You need them for energy. But at the same time, you have to have the right amount. So if you go out every morning before work and grab an egg sandwich, with your greasy English muffin, then you're going to have a lot of added salt, which is going to help you retain fluid. It's high in fat, and you're going to not use that fat as energy because you're actually not using it in what we call a ketotic way, so that the fat can be burned as energy. It gets consumed and converted and stored as fat. So we have to look at what we put in our mouths, when we put it in our mouth. So, for example, a common way of reducing weight would be to eat a better balanced diet. Say, take a small dinner plate. 1/4 of it is protein. 1/4 of it is going to be your carbohydrates, whether that's in grains, legumes, or whatever. And then the half of the plate is going to be in vegetables and fruits. Now, you don't always want to have the high fructose, high sugar fruits. So you do want to limit those. But you still want to have fruit in your diet because there are many vitamins and minerals that are beneficial to you. The other thing is timing. So if you're going to eat breakfast at 6 in the morning, but you get home from work at 8 o'clock at night, you've created a 14-hour eating window. Well, you want to narrow that. You want to have, say, a 6 to 7 hour eating window. And then the rest of the time, you're fasting because your body now has to rely on its body stores, and it's not going to rely on the energy stored in your muscle and your liver. It's going to go to your fat because fat is the easiest thing to access for energy. If you're sedentary, you can actually lose weight on something called the ketogenic diet, where it helps your body develop enzymes to utilize fat for energy instead of you consuming carbohydrates to use as energy. So narrowing your eating window, balance the diet better, and then you have to look at exercise. Everyone should have some kind of exercise on a daily basis. Men, they try to go into the gym and they want to, be macho and lift heavy weights and, look like they're studs. The reality is they're better off doing a low to moderate aerobic exercise and low to moderate weight training program, and they're going to get more benefit out of that than if they're trying to, squat the ultra heavy weights.
I was reading recently that the COVID pandemic has affected men's health in far greater numbers than it has for women. Tell me a little bit about COVID and men's health.
Well, COVID, because of the side effects of, the DVTs, the microvascular and large vessel inflammatory diseases, consequences, I should say, the autoimmune responses, some men are reporting almost like arthritic joints after a COVID infection, respiratory fibrosis and asthma, new onset asthma after COVID, or COPD or emphysema after COVID are becoming increasingly more common for some reason with men than they are with women. So the virus is affecting the sexes differently. There are crossovers, but there are some higher percentages within men.
That's very interesting. So as you know, I recently read an article speaking about COVID, and I kind of thought it was a weird conspiracy. What about COVID and erectile dysfunction?
Yes, there is now quite a bit of literature coming in that COVID infection is showing an increase in erectile dysfunction. Now, part of this unfortunate side effect is from the effect COVID has on the inflammatory response syndrome microvessels, which predominantly affect the penis and the heart. But you're looking at also some hormone changes. We're finding that testosterone levels are elevated, but all of a sudden we're now having more holding of testosterone into by this aromatase conversion into estrogen. So there are side effects of COVID that really are affecting not only male sex hormones, but the function of the penis itself. There is therapy, fortunately, that is ranging from 40 to 70% effective for erectile dysfunction, and it's called low intensity extracorporeal shockwave therapy. Now, we've actually used shockwave therapy on cardiovascular disease before. Shockwave therapy will essentially administer these microbursts of shocks into the tissue, causing not only the plaques to start to loosen up, but start to break down a little bit, and it relaxes the muscles and creates dilation of the vessels. And essentially, that's what happens for an erection. You need dilation of the blood vessels to increase blood flow. Now, how the low intensity, or we just call it ESWT, how that works is pretty simple. And I brought one of the devices to show how this works. So I want you to imagine this little prop as a phallus. And gentlemen, after you've received the treatment, do not get wishful thinking. This is just a paper towel roll. But once we turn on the machine, this is the actual unit. Sorry, there we go. That's used to administer it's very scary in the beginning, but it's a very almost like microburst of shocks. So we simply run this over the shaft of the penis for about 300 shocks per area along with the side and along the side of the scrotum. And this particular treatment is showing to be 40 to 70% effective in returning a large portion of erectile function back to a baseline that is appropriate for your age. Men have wishful thinking, so therefore do not expect more than what the treatment can give. But combined with, say, a PD5 like Cialis, Viagra, Levitra, exercise, losing weight, you would be surprised the number of my patients that are now having normal sexual activity that they were having 15 years ago. So while shocking to listen to that machine, it is effective when you combine other treatments with it. One treatment is not going to solve the problem. You have to remember it's a multi-system thing. The psychological aspect of getting an erection is just as important as the blood vessels being non-functioning. So all of this has to be worked in a package. So when you get men going to these men's treatment centers and all they're doing is the shockwave therapy, well, they're missing out on the rest of the human body that needs to be treated for this. Relationships are also important. Your spouse can be an integral part of sort of regaining your self-confidence, building your stronger relationship out of this treatment process. Because in the beginning, you don't see instant results, but at the same time, having a supportive spouse can psychologically give you a better attitude. And as we say, positive thinking can get you through some pretty bad illnesses.
So I think it's hilarious that you talk about a shockwave machine being shocking. That was amazing.
That was not what you would expect for shockwave therapy, listening to it. But that's what it is.
The other thing that I thought was so funny is you're talking about men getting wishful thinking, because that I know several men who watch those Viagra commercials, and it's, if you've had an erection lasting more than 4 hours, go to the emergency room. And they're like, I'd just call another girl. And I'm like, you need to go to the emergency room.
No, you go to the emergency room. Yes. Yeah, there are side effects to all of these medications. So any of the common erectile dysfunction medications, they run the risk of hypotension, so you can pass out from low blood pressure. If you're taking a nitrate, such as sublingual nitroglycerin or a couple of other medications, you can bottom out your blood pressure. So you have to take them on the advice of your doctor. Too many places online are offering these medications, and they're fake medications that have toxins in them. There was a batch of Viagra that was caught 2 years ago that I think it was arsenic was found in them. So I'm not exactly good for your sex drive or your sexual function.
It's not good for your life either, arsenic.
No, arsenic was and is used in a couple of medical conditions, but it is a therapeutic dose that is so low it's negligible.
That's very, very interesting, and I think that you're onto something when you talk about the whole they go in for the shockwave or something, because a lot of times that's how men's health is viewed, right? Men's health is viewed through impotency. But since we're talking about relationships, Larry, when men go to get medical care, do they get screened for things like sexual assault and domestic violence in the same way that women do? Like, I always get asked, do you feel safe at home? Do men get asked that as well?
In the last 2 years, that has become standard on all of the forms for intakes and clinics that I've been in. So I think it is catching on. But originally, the intake form was a generic form, and some questions were actually marked for women only. They lumped together asking about your menses, asking about spousal abuse, things like that. But at the same time, you have to realize men can be abused by female and male partners. They can have sexual abuse from female and male bosses. This is not something that is unique, but we're just now getting to this in sort of a medical legal realm. Some men have taken sexual harassment cases to court and won. At the same time, guys sort of joke about it and go, "What's your problem? You sued because she hit on you?" Well, if you're happily married, you would not want that kind of situation to infect your home life, and you wouldn't want it to put your career at risk, which could be career ending in some cases.
Oh, of course. I mean, women run into that. So I used to work for a medical device company, and I had a male boss, and I always left the door open when I went into his office. And so one day he says to me, you can close the door when you come in here. And I started laughing, and I knew he was a Muslim man, but I didn't know what the traditions were in Islam. And so I wanted to be respectful. And so after this, I went to lunch with some of my coworkers, and they were men because I was the only woman on the team. And one of my coworkers, he started laughing raucously at this. And he said, our boss had said to me, well, men should be more sensitive to that. But this man who was laughing hysterically at lunch, he said, the Me Too movement really hurt a lot of women at work because men didn't want to be in an office with them because exactly what you're saying. Anybody can say anything or do anything, and
Correct.
there's no witness to anything. It's very dangerous in some cases for men if they have a predatory woman, just like it is for women with predatory men in the workplace. Yeah.
Oh, yes. So, no one is immune, but for some reason it was never discussed with men because the male ideal was that what man is going to turn down sex, but at the same time, what man in a healthy relationship would want to mess up his relationship having illicit sex.
Plenty of them do it. I mean, I don't know, but plenty of people do it on both, and both plenty of women do it too. I mean, I don't know. It's not something that I've ever felt driven to.
If it is consensual within the couple, that is their business. However, I don't, in my years of practice, I don't have any patients that have admitted to having an open relationship. So therefore, I think there is a modicum of discretion, that men still hold, they hold their cards close to their chest. They don't want people to know what they're thinking or feeling. But they really do need to express what's on their mind, because sometimes those little events at work or at home can be the underlying cause of something that could be more traumatic or dangerous or hurtful in the future.
Of course. Are you guys as clinicians, are you trained in awareness for some of these situations that come up? If you have a male patient come to you to disclose some of these things?
Yes, it is mandatory in medical training to handle these situations. We are mandated reporters for anything that involves a child. But we cannot, like if a woman is assaulted, we cannot report that without her permission. Personally, if that were my wife and she had been assaulted at work, I would want it reported and the person arrested. But the laws do not protect either the women or men in those cases, only the children and the elderly.
Right.
Which is even more disturbing.
There's a lot of disturbing things in the world, Larry. It just,
yes.
It is the way it is. Do you have any final thoughts on men's health? I really didn't have an outline for us because, as I said, I don't really know enough, but I feel like men are humans and we should treat them as such.
Well, again, men have feelings that they don't often discuss. They need to be willing to talk to a healthcare professional about things that could be bothering them in terms of their job, their relationship, sexual dysfunction. They need to do more than just go to the doctor and say, I want the little blue pill. Because working up sexual dysfunction is far more complicated than simply drawing a testosterone level. There are 13 labs that I commonly draw for all male patients. And you would be surprised. One of them, luteinizing hormone. I mean, this is commonly drawn for women with irregular menses, but we do that with men because we produce luteinizing hormone. So we need to find out if there's something in the imbalance of our hormone production. You need to make certain that your doctor is actually paying attention to your questions. Many doctors, when you start talking about erectile dysfunction or poor libido, they pull out the prescription pad and just give you a script and here, try this. The try this approach is no longer effective. We need to have more time spent with patients, more in-depth study in terms of research on how the entire system works, not only the hormones, but the psychological triggers that make us happy, that make us sad, because we don't normally show those feelings. So there are many things that we're just scratching the surface on, but I think men need to be more open and honest with their providers and make certain that their provider is listening.
I think that's great advice for anyone, but I think that's especially true for men. I know that my husband has often complained, when he's gone to healthcare professionals about they're not listening, or he doesn't like something about them in regards to the way they're presenting the knowledge to him, or whatever it is. It's these little things, and I think that that's probably true. I know it's happened to me a couple times with providers, but it happens to me a lot less. And so I think that that's really good advice to have a good relationship with providers and healthcare professionals that you trust, and to be able to make sure that they can do their job, and that you as the patient can do yours, because it should be a partnership. So thank you so much for coming and sharing all of this knowledge, and showing us how shockwave therapy works. And I was today years old when I learned that men produce luteinizing hormone. I didn't realize that. So our education system is woefully inaccurate. I've gotten a doctorate degree and had no idea men produce luteinizing hormone.
And we produce and all sorts of fun stuff.
All sorts of fun stuff. So thanks, Larry. This has been like a great time, and let's do it again soon.
Thank you for having me on, and I hope to discuss more with you in the future.
Definitely.